I'm Nick Wilkinson. I'm a paediatrician who set up services around the UK, and I have a particular interest in self-management. And
I'm David Hanna. I'm a consultant in paediatric emergency medicine. And I'm interested in how we can get things to work. How do we make things happen? How do we innovate? And how do we deliver value-based healthcare?
So today's session, I'm really excited about, mainly because of the two speakers that we have. So one is a GP and one is who's has lived experience as a patient and is a consultant for the King's Fund. We'll introduce each of them as we go through. The aim of this really is to draw out some of the points that are relevant to value-based healthcare, and obviously self-management is a very key thing to this. And hopefully we'll cover, well, what do we mean by self-management? Should we crack on?
Yeah, let's. So our first guest is Dr. Liza Thomas-Emrus. So Liza and I know each other for probably about 20 years, as we were both medical students in Cardiff University. But Liza is currently a GP. She's trained as a GP, but in addition to that, she is clinical lead for the Wellness Improvement Service based in Cumtaff Morganic Health Board. And we've asked Liza to be our guest today to tell us a little bit about the service, which really is rooted in patient self-management. So without further delay, I'll hand over to Liza, and we'll hear more about what she's doing in Cumtaff.
Okay, thank you both. Let me just share my screen here. Get on the slides. Right, you can see those slides now, can't you? Yeah. Right. So yes, my name's Liza. I'm a GP with an interest in what's known as lifestyle medicine. So I'm a member of the British Society of Lifestyle Medicine, and I also do intermediate care medicine at Ysbyty Cwm Cynon in our health board. And as Dave rightly said, I'm the clinical lead for the new service, which is called the Wellness Improvement Service, or WISE as it's known for short. And just to let you all know, I'm also a wellness innovation lead for Respiratory Innovation Wales, and I write meditations for various health problems and put those on YouTube. So just to give you a background to this service and an introduction to this service. So over 700,000 patients in Wales are on a waiting list at the moment. So that basically means that there's 1 in 5 people on a waiting list in Wales, and the watchdog has said it's probably going to take us about 7 years to clear the backlog. So when I was before starting the WISE service, I was in the field hospital, and I was asked by our executives whether or not lifestyle medicine, which is the field that I practice, could help tackle the waiting lists. And as you can see, it's a pretty huge problem, and my mum was adamant that I should not get involved. She said, don't get involved, you've just done the field hospital, just put your head down and just let it be someone else's problem. Just don't do it, because it's going to be impossible. And I'm sure quite a few of you feel the same, that it is a massive challenge to try and do anything that might impact our waiting lists at the moment. But before you lose hope, I just want to start off by sharing this quote from a patient who's involved in our service. So one of our ladies said, after being cut off from life for so long, it was so wonderful to be with you all yesterday, to talk, to laugh and to learn again. I felt more alive than I have in years. You were all so kind and welcoming. It felt like coming home. So that to me is, it's worth doing. It's worth taking on this challenge. So our WISE service is rooted in lifestyle medicine. So lifestyle medicine has these pillars that we try and balance out to create wellness, to focus more on wellness than the illness itself. So the main 5 pillars that we focus on are social connection. So that's you and your support network, so your family around you, your friends, any groups that you're involved with, work, mental well-being, so reducing the effect of stress, improving your mood, improving your sense of well-being, physical movement, so any type of exercise or movement that gets you moving again, obviously healthy eating, and the other one is sleep, so improving your sleep so you can actually regenerate. And then we also, so the 6th pillar of lifestyle medicine is addressing any alcohol, smoking or drug use. So we signpost out for relevant services for support with any of those issues. So the service was initially set about because of the Planned Care Recovery Initiative. So because after COVID we had mounting waiting lists, we were given this recovery monies from Welsh Government to try and do something to help with these patients on the waiting list. And as a GP, when I refer a patient to a waiting list, I often find that the patient just gets into this mindset of just waiting, and as they wait, all of their other health problems gets worse. So invariably the symptom that I've referred them for gets worse, and its impact on their life and their quality of life, as well as their family around them, but also every other health problem gets worse. So their diabetes can worsen, their mental health can get worse, their blood pressure, their weight all increases. So I really wanted to create something to try and mitigate those risks, as well as something to try and improve symptom control, and hope that by having that sense of control over your own health, that it feels like you're being proactive and doing something, and that lessens kind of health anxiety as well. And to try and ingrain the culture of self-management as part of routine healthcare, that actually, you know, it shouldn't be an alternative, it should just be routine for all of us, that we need specialist help sometimes, but it's always on a foundation of self-management that we should all have access to. And to try and stem flow onto secondary care lists. You know, we're under so much pressure in primary care. We have very, very short appointment times. It can often lead to referrals. And we want to give an alternative where patients might find that their symptoms improve through doing self-management. So WISE is actually a wellness coach service. So they have coaches that basically coach people to learn about self-management and what actions you can take. And they're initially seen one-to-one, so they have a one-to-one with their coach to do baseline assessments, and then they go into group coaching. So they benefit from that peer support as well. And we often have volunteers who are expert patients or who have done self-management programs before, who volunteer next to the coach to add their personal experience as well. And they can have coaching for up to 9 months. So some people will choose 3 to 4 months, and other people can have 9 months if they need extended coaching. And the patients can choose face-to-face or virtual, and the face-to-face locations are in community settings across our whole health board. So often in rugby clubs or community halls, leisure centres. Our coaches have spent a lot of time going to venues to make sure that they're accessible, that they're on the transport links, that they've got disability access, those kind of things. And we offer hard copies and digital resources, and we try and encourage self-monitoring. So the coaches will coach patients in the importance of monitoring their own health markers. And then those measurements are repeated at 3, 6 and 9 months to make sure we're actually getting somewhere. And at the moment we've got 7 coaches. So if 7 coaches were up to their maximum capacity, then in theory they could support up to 5,600 patients annually. And we link heavily to community services. So social prescribing is a big thing in our service. And we also try and maximise the potential of our volunteering service, because they can bring so much support to our services. So just to give an overview of what kind of measurements we do at the start. So MyMOP is something that we're finding really useful. So that's Measure Yourself Medical Outcomes Profile. So it basically asks the patient, what's important to you? Name 2 symptoms that are affecting you the most, and how does it affect your day-to-day life? And how do you feel about medications? Do you feel you want to come off them? Is it important to you to come off them? How are you managing them? And obviously things like height, weight, waist circumference, BMI, blood pressure, their well-being scores, readiness for change scores, as well as smoking, alcohol, vaping. And obviously our health board do prom and prems as well with it. We've been trying to set up research opportunities as well. So we've got Bristol University undertaking research about the experience of patients with fibromyalgia. It's a Bevan exemplar project as well. And we've got Cardiff University researching how the arts and health are affecting our patients, but I'll come on to that in a minute. So our referral pathway is super simple, obviously designed by a GP. I need it to be quick. So basically, if you're anyone who's over 18 at the moment, although we have plans to extend that to adolescents and families as a whole, but at the moment it's anyone over 18. If you've got a chronic health condition, a chronic symptom, if you're on an NHS waiting list or at risk of going on an NHS waiting list, and you feel you'd benefit from the support of a coach, then you can be referred to us. and it's via our website, which is ctm.wise, or email, so ctm.wise@nhs.wales.uk. Wales.nhs, you know, the usual. So email or website, and then our admin team will phone the patient, talk about the service and what to expect, and then they get booked in for a one-to-one with their coach, and then their group coaching from there. And if they've got really complex needs, or they have certain medical questions that they feel haven't been answered, then the coaches refer to me, and I do group clinics, or sometimes one-to-one if the patient is extremely complex or very distressed. But the majority I'll see in a group clinic, in a virtual group clinic. So just to give you like an example of a patient that came to us. So names obviously have been changed, but a 66-year-old lady who was on the chronic pain waiting list due to rheumatoid arthritis and osteoarthritis, suffering from chronic pain as well as lymphedema, and the pain was restricting her so much that she could barely mobilize around her own house. And she used to be very independent and drive and go out and look after her grandkids, but actually because of the level of pain had heightened so much and her mobility had restricted so much, she was actually confined to her house, and she couldn't even go up the stairs. So she couldn't sleep in the same bed as her husband, so that was having an effect on her marriage. She could no longer look after her grandchildren, so that was affecting her identity as a grandparent and her role in the family. So she really felt like her whole life had been consumed by her symptoms. Now, after 4 weeks of attending coaching with her coach, and she came to one of my virtual group clinics, her mobility had actually started improving, and she was going to the gym via the National Exercise Referral. And because she was mobilizing so much, she'd lost a stone quite easily without having to adjust too much of her diet. But importantly for her is her independence had regained, and she was able to leave the house again. And her requirements for pain relief had reduced as well. And she just felt like her sense of identity was coming back. So she was filled with hope that after 4 weeks, things were getting better, and she was actually going to improve and feel more like herself again. Because her sleep was so affected, because she was sleeping in a chair, not upstairs, I'd given her a lifestyle medicine prescription to help improve her sleep moving forward. So we obviously partner with lots of community and partners in around the community. So Get Fit Wales is one that I'll come on to in a second, but EPP, so a lot of the foundation knowledge that the coaches share is from Public Health Wales for the Expert Patient Programme. Digital Communities Wales is a really important partner for us. So if a patient wants to do this virtually, but they don't have, they suffer from digital poverty, so they don't have internet, or they don't have a smartphone or a laptop or a tablet, then we can contact Digital Communities Wales, and they will go into the patient's home, set the internet up, give them credit, plus teach them how to use that. So incredible, incredible charity. Mental Health Matters Wales are very important to us. To offer lots of community support, cooking lessons from Cook Together Wales, lots and lots. You can see anyone who's basically on the same mission as us, we want to collaborate with them. So Get Fit Wales is being really successful in our service at the moment. So Get Fit Wales is a Welsh organisation through Newydd Housing, and they will come to our sessions and offer Fitbits to the patients, and then set like a baseline step count. And as they set goals with their coach to increase their step counts, they'll get vouchers to spend in local small businesses. So beauticians, hairdressers, Cheryl Fruit and Veg Shop in Abercynon, you can see here, the butchers is really popular. So we're actually trying to engage people in supporting local businesses and eating real food that's local as well. So you can see 3 of our lovely participants here who are all excited about their plan to engage with the Fitbit and the Get Fit Wales service. So just, it's too soon to give you major data at the moment because we've only just started, so 3 to 4 months in with patients. But some of my team looked at some just sort of crude figures at the moment of some of the patients coming off the pain waiting list. And 95% of those have reported increase in their physical activity. All of those participants noticed an improvement in their well-being scores. with 95% improving their blood pressure and 80% noticing a reduction in their weight and improved BMI. But we're going to do a full evaluation based on all of our numbers, obviously, as the time progresses. But an important quote to share here from patient experience. So I wouldn't have ever gone away on my own before attending WISE, but it has given me the confidence to book a hotel just for myself to stay for the weekend, when usually I would never do anything that didn't involve someone else, and I would always put someone else's needs first. But I'm now putting myself first. I had to convince my husband I wasn't having an affair. And another patient, I was so not sure if WISE would help me, and I cannot believe how much better I feel in such a short time. I'm starting to understand my condition and no longer need my crutches. I've started walking and I've lost weight. The coaches and group are so helpful. So at the moment, we're getting referrals, self-referrals every day, and referrals come from primary care, so their GP, their physio, their pharmacist, anyone, any healthcare professional, but also self-referrals. And then we're also contacting patients on long waiting lists as well to offer them the service. So at the moment, about 850 patients are being processed through WISE. So we're hoping to get big numbers through the service. And just to close, this is another quote from a patient. Where has this been all these years? I cannot believe how much I needed this and how simple it is to help me look after my health. The coaches are really supportive, and I never thought I would take part in a group, but it's not what I expected. Right, so let me just close that. Sorry, that was just a whistle-stop tour of the service, because I know you didn't want death by PowerPoint or really long presentations, and we wanted to have more of a chat. But that gives you a bit of an overview about what we're trying to do. So it's a coaching-led service. So the coaches will basically do coach sessions for as long as the patient needs, but up to 9 months, and do basic foundation knowledge on all those pillars of the lifestyle medicine. So how to improve sleep, how to get more active, how to eat better, how to improve your mental well-being, how to improve your social connection, and then support from specialist services about reducing alcohol and smoking or drug use as well. And then the hope is that by balancing those pillars, that their symptom burden reduces and they feel more control over their health. So that's it.
Well, Lisa, thanks so much for giving us what is very, very far from a simple PowerPoint presentation. That was awesome. And some of the things that jumped out at me from what you described were you described the pillars of the service, and many of these, although the effect they can have is radical, they're a low barrier to entry. So things like diet for many people can be a challenge, but should be something we can help them with. Alcohol, smoking, exercise, and I know where you work, so I know there's the communities where it is difficult to reach people, whether it's digital poverty or other types of poverty as well. And something that struck me coming through is in a way, the simplicity of the service, which should mean that it should be accessible to many people who traditionally don't access healthcare easily. What's your experience of that with these hard to reach communities?
I would say it is really difficult to get engagement, and you do think it is really simple stuff, or that this is stuff that everyone knows or everyone should be able to do by themselves. But there's so many barriers. That's the thing, is it's so complex to eat better. You think just buy fruit and veg, but it doesn't actually come down to that in practice, which is why we all find it really difficult. Community engagement is really difficult, and we sort of knew that was going to be really hard, which is why we've gone out to the community and tried to partner up with so many third sector organizations to say, how are you getting people here? Because it's the same, it's the same people we all want to support. So what's working for you? What kind of messaging are you using? Can you help us spread the word that this is available and people can self-refer to it? Yeah. And what we're hoping is just by going for big numbers, that kind of supports a culture change, because that's what we need. We need the whole community to change together rather than it just being individuals by themselves, because that's always going to be harder, isn't it?
Yeah, absolutely. And you know, South Wales is where Julian Tudor Hart was a GP, and he wrote about the inverse care law. And here we are 40 years later, or whatever it is, and exactly the same challenges
Still challenges,
exist.
yeah.
Except it isn't a law, but and that's what we're trying to prove. So I'm just, you know, I'm really struck by, one is about the engagement of the community, but also it's ultimately the engagement of individuals. And you described the lady with chronic pain for 4 years. What do you think was the hook for her? What changed for her that meant after such a short period she could change?
I'll tell you what the hook is for many of them to come in, which is a sense of, the sad thing is a lot of them just feel so hopeless that nothing has worked, that they're just kind of willing to try it because it's new. And they're, you know, we change through two things, don't we? Either from desperation or inspiration. Now, the sad thing for a lot of our patients is that they hit desperation and then they're just desperate for anything. Whereas what we want is to get out in front so that people change through inspiration. But for her, nothing had worked. She was on all of the painkillers. Her GP had said, you know, we've got to reduce all of these opioids because, you know, they're not working and you're on them, all of them. And we ran out of, like, nothing new was invented. So she just had heard about it through her GP and just thought, well, I might as well, and didn't really feel like it had much chance of working. But for her, I think being around other people who are in a similar situation and having that peer support, and I think importantly, hearing from someone who's been there before. So the volunteer saying, I was this bad, and, you know, I really felt like I had no quality of life whatsoever. I was just surviving through pain every day, and I barely felt like I was surviving. I think hearing that story and noticing that that person is actually better, for her, it was just worthwhile carrying on. And I think just having a sense of control and action steps that the coach is creating with her is making her feel more in control over her own health.
So can I just so we're starting to get some questions through from our audience, and please keep them coming, and we will try and share those questions. We'll move on to Mark very shortly, but just for me to pick up on this is how much, because one thing I constantly hear through my service is that the patients just want to be heard. So so they feel that there's lots of assumptions about them before they've even sat down.
Yeah.
And I just wonder, so do patients go straight into the peer support, or do they have interaction with you or one of your colleagues beforehand? How does that work?
So they have their one-to-one with a coach, you see. So the coach does the one-to-one where they sit down for about 45 minutes to talk about what is important to the patient and how is it impacting their life and what kind of goals they have for their life and how do they want to live. And I think that gives them the opportunity to set the record straight, because a lot of people do say, oh, they all just don't listen to me. I mean, there are all these specialists and none of them listen to me. And they all think I want tablets and I don't.
So how does the patient then switch from what has been originally a diagnosis-led care to what you're describing, which is a needs-led care? And are patients comfortable with that? What's the feedback from your coaches about that?
Well, the coaches are they're kind of overwhelmed with the story of, oh, they all just say to me how they've never been heard before. You know, that's what coaches are repeating over and over and again. And I just think that's so sad that actually as specialists, why are we doing that so wrong? You know, we should all be able to do that, shouldn't we? And yes. I get that we're all under huge time pressures in our consultations. Of course we are. And we have our own things that we need to bring into the consultation. But for so many of these patients to walk away and say, this is the first time I've ever been heard, and this is by a coach who's non-clinical by background, I think that just shows that, you know, we do need to reflect on our own consultations, I would say.
Brilliant. Thanks, Lisa. We'll come back to you when we have a sort of joint conversation then with Mark.
Yeah.
So I've known Mark for several years. He's, as I mentioned at the start, he's a senior consultant with the King's Fund as a member of the leadership and organisational development team. He has huge impact, and that's included being the co-founder and director of the the Center for Patient Leadership. He's designed a number of award-winning patient leader programs and advised organizations, including NHS England. He is a patient with lived experience, and so we're really glad that he's joined us. Are you there, Mark?
I am. Can you hear me?
Yeah, have you got your camera? Are we able to see you?
Yeah, my camera's on, isn't it?
We'll see you now.
Yeah, good, cool. So thank you for the introduction, Nick. I'm going to do something in what I'm going to say, which I don't normally do, and Nick knows me. We've had numerous conversations. I tend to speak off the cuff, but if I do that, I can get very over enthusiastic and go off message, right? And I'm aware I've got a very limited amount of time, maximum of 10 minutes. So I'm going to talk from a script. So bear with me, please, because it's not my normal way of doing things, but I want to make sure I say what I want to say in the time I've got. So my interest in self-management emerged from me developing a life-changing disability, a chronic condition, which was severe psoriatic arthritis in my mid-20s. And this had a profound impact on me, as you can imagine. It was incredibly overwhelming in those early years. I felt helpless, and I was listening to what Lisa was saying in her presentation, and so much resonated with me. Everything felt hopeless, physically, emotionally, and existentially. Who was I now that I had developed this chronic life-changing condition? Who was I? Because that's going into the healthcare system. I quite understandably and quite rightly was being treated for my arthritis initially. But as an aside, I am going to go as an aside. I was also trying to deal emotionally with the condition, and unfortunately that was medicalized. So I ended up going into psychological support as well, and antidepressants. It felt like the jigsaw puzzle that was my life had been thrown into the air, and that the pieces shattered and came down to earth, and my life was about trying to put it back together again. Now, as many people with these life-changing chronic conditions at this stage, I ended up dealing with the loss and grief of the person I was. So I went through denial, anger, depression in those early days. And I didn't have the capability or capacity for self-management at that stage beyond the simple regimes given to me by the medical profession in order to help me deal with my recovery, i.e. taking medicines, general basic looking after myself. And I could do that. And I put completely my faith and trust in the relationship with my healthcare professional team. The power and control very much lay with them. I gave it over to them, right, willingly in those early days, because I was at a loss. And I regressed, or it was almost like a parental relationship. I guess at that stage, I was learning how to be with myself as much as how to manage my condition. But as I said, it was more to do with the be myself. This went on for a number of years, and I think that's important. There was a process to this, but a number of years into my recovery, my level and quality of self-management fundamentally was transformed by a visit I had from somebody when I was in hospital. I was in a hospital for one of my routine flare-ups that were needing to be managed with looking again at my medication. And during this visit, I had during my hospital stay, I had a visit from a very old acquaintance who I'd not seen for many years, lost touch with, and he was down on holiday, and he came to visit me one afternoon, and he stayed all afternoon, and he then came to visit me for 4 days in total, 3 days after this. What I didn't know at the time was this man lived with a number of long-term conditions as well, hidden conditions. He was also trained as a counsellor and a coach. And I assumed I was going to get a casual visit from somebody who would just have a chat. Actually, what I got was a structured series of coaching conversations facilitated by a kind, compassionate guide and mentor. He did this through, amongst other things, really listening, being present with me, asking questions that challenged my thinking, my assumptions, and my beliefs. And he showed up with a real compassionate presence that during these conversations, for the first time in 8 years, and this will resonate with Lisa, I felt seen and I felt heard. And up to then, I didn't know what that meant until this man sat there by the side of my bed, and it was hugely impactful. I resonate completely how transforming it is to be seen and heard. I don't have time to dissect what the talk was about and how it worked, but it absolutely worked. By the time that our conversations had finished, I had reframed my relationship with my health condition. In fact, I've reframed my relationship, and relational is at the heart of all of this that I'm talking about, with myself. And I reframed my relationships with my assumptions and my beliefs. And I helped to see the world differently through a lens that saw me much more in control and and able to manage myself. Now, the reframing supported me, and here's the challenge, which is at the core of what I'm saying. It helped me to self-lead my recovery. Now, what do I mean by self-leading? Well, I was able to create a clear sense of what was important to me, and I summed that up in a very clear vision and picture of myself. My vision was, I want to learn to live well and fulfilling life now that I have arthritis. So my purpose was to make sense of what a well and fulfilling life looked like, and to try and make the conscious decisions and choices to make that happen. So the whole idea was, I would know, if you were to ask me, I could tell you what being and living and doing with arthritis well would mean, and particularly in relationships. And this vision was motivational, energizing, and importantly, I really believed in it. Now, in the context of this talk, the capability to lead myself with my arthritis had a profound impact to self-manage myself. Self-management fell out of my ability to self-lead. Because if I could lead myself, self-management was an automatic, unconscious response. Self-leadership is about doing the right things for my health and well-being. Self-management is about doing things right. So leadership, doing the right things. Management, doing things right. I've got to thank Peter Drucker for that, but it's just made so much sense to me. Now, the final part of this jigsaw was a set of daily practices that underpinned a way of being that supported me in living well and my vision. So paying attention and noticing, living in the moment, being mindful, making choices, taking decisions based on the values and principles that were important to me, and being kind to both myself and those others, particularly my healthcare professionals, who I had been, as an angry child, very challenging at times. I dumped all my anger on them. Lisa, Nick, you will know those patients. And so I made a commitment to try and be as kind. So the focus on self-leadership not only led me to develop a coherent, integrated practice of self-management, it also changed my relationship with my healthcare professionals. I proactively went out to influence the quality of these relationships in order that it would support me to live my vision. An example was meeting a new rheumatologist for the first time. He sat down there and understood understandably focused on my blood test results, which showed that my my inflammatory markers were high. He wanted to increase my dosage of my methotrexate in order to suppress those inflammatory markers. And I had to tell him if he did that, I would be sick for 3 days out of the 7. And that as part of my commitment to my vision of living a well and fulfilling life with arthritis, I needed to manage my emotional well-being, my mental health. And that meant that I needed to get out and walk every day. And in order to do that, could we negotiate where he felt as a medical professional, he was adhering to his ethos and the protocols, but at the same time, he could meet me where I was at, where I needed to have an ability to live well. We had a fantastic conversation, a conversation rooted in listening, hearing, and we came out with a partnership, understanding. And for the first time, I felt that not only did I have somebody working alongside me, but I felt he was actually in service to me. And I'd never felt that before, never felt that before. And it changed our dynamics and our relationship. So I just want to add one final thing because I'm aware of time. So a combination of self-leadership, self-management has not only influenced my relationship with myself, my health condition, it's also influenced my relationship with others involved in my healthcare. But it's also influenced my relationships with the wider healthcare system. So given my experiences and the journey I've been on, I was keen to help other patients and service users learn how to lead and manage their own health in this way. I also So I set up the Centre for Patient Leadership with a colleague of mine. I also developed something called a model of collaborative pairs, where healthcare professionals and patients learned how to communicate and work together in order to achieve not only results that helped them manage, the patient manage their care, but work together to influence the services that were being currently designed and delivered. And guess what? Just as you put in the title, collaborative pairs don't happen by accident, right? It takes hard work to do it. My work, I've worked in Wales, actually. I've developed patient leadership programs with Public Health Wales, patient leadership program for all Wales adult cystic fibrosis service, and a program for the Vilindra Cancer Centre. I've also delivered a collaborative pairs program for health organisations in England and Australia. So finally, what have I personally learned about patient self-management from this? At the heart, it is so much more than a set of tools and techniques. It's grounded in the type and quality of relationship I developed with myself initially, with my relationship with my health conditions, and then my relationships going out with those that supported me with my healthcare and then the wider system. For effective and efficient self-management to emerge, I absolutely passionately believe it starts with self-leadership. Get self-leadership right, self-management will fall out of it. And it's rooted in me seeing myself as a human being first and foremost, and a patient secondly. It's about seeing me holistically and my health history holistically, and all of this profoundly influences the choices I will make about managing my conditions. Self-leadership and self-management. Thirdly, self-leadership and self-management supports a quality of relationship between the patient and healthcare professional that I've witnessed can impact the quality of services, particularly their design and delivery. From the approach I've suggested, I've witnessed the development of collaborative partnerships at the strategic level that have influenced organizational cultures, system cultures, the way things are done. This supported and is supported by the co-designer services. It started with decision making at the individual level between the clinician and the patient, and it can be developed strategically as well. Finally, I hope you see from what I've said that patient self-management is based upon a set of conscious choices one makes involving practices that don't just happen by accident. They need to be nurtured, encouraged, they need to be supported in a spirit of kindness. And this takes a particular focus, a particular mindset. But from my experience, the time, effort, and commitment is well worth it. Thank you.
Brilliant, Mark. Thank you very much. That was just fantastic. And you know, I would welcome a lot more patients like you in clinic that would just pull me up. And I just wondered, you know, this is obviously a medical forum, and you talk about the partnership, and what sort of advice do you have to encourage others to speak up as you have? Because that's quite brave, isn't it?
I just think, well, I think Lisa's nailed it as well, right? It's about a different relationship that one has with the person that you're engaging in to have a conversation with.
Yes.
So it's if you show up with a genuine desire to truly want to hear and to truly hear the other person, then what will happen is, for me, that person, we know this, it's not rocket science, it translates to the other person. So I would just say it's how we show up in the conversations we hold with another person.
I think that you're right. It comes back to exactly what we were taught at medical school, and for me that was several decades ago, which was just put the chair in the right place. That actually allows you then to begin to have that conversation. If you've done that consciously, you've consciously said to yourself, well, I'm going to find out more about this person.
Hang on. Yeah, but come on, yeah. But how many times will patients tell you that they've gone into a consultation room and they've gone, oh, my clinician has been on a course? How do they know that? Because their computer screen is gently turned towards them and the chair is by the side of the desk, not behind the desk, right? So there's something, it's more than just putting the chair in.
No, that's not what I'm saying. What I'm saying is that's just a part of the signposting for the cognitive effects of the clinician, whether they're a coach or not. So, okay. and you know, just going back as well. So for your journey has been over several decades. Why is it now that we still think that this is innovative? You know, and you've been pushing this agenda. Can you answer that? What do you think are the barriers?
Oh my goodness. How long have we got? I mean,
just quickly.
Really, just quickly. It's obvious. There's something about how we view and see healthcare and medicine, how we train people, the education we give people. You know, what comes first when you walk into a hospital? How many times have I walked into the hospital and I have felt that I needed to fit into a system rather than really feel what I know I'm told, that the patient is at the center of everything we do. It often feels like the system is at the center and we and the clinicians have to fit to the system. So if the system is at center stage, what's that telling us about the view of medicine? So it goes way beyond, for me, a simple conversation. It's about our mindset. It's about our view. It's about the conversations we need to have. If we could have more conversations like this, I believe we would truly start to change healthcare. But we need to have more conversations like you're putting on.
So Mark, spot on, I think. And that links to something I'm quite passionate about, is that we know, we think we know this, right? But Lisa and I were in Cardiff in 2003, 2004 medical school. We were taught about the biopsychosocial model, right? Okay, and that's, you know, this should be a known. And it comes back to what I often see is that it's not that we don't know what good looks like or what we should be doing, but the how to get there is the conundrum sometimes, or maybe we don't know where to go. But Lisa, I'm interested to hear from you about the how. So you had, and Mark, you talked about vision. Lisa, you had the vision. but how did you actually put that into action?
Well, I think for me, getting this service up and running, I suppose that's where COVID was a bit of a blessing, because there was so much media attention on the new world. You know, people are ready for a new world, new NHS post-COVID. You know, a lot of that words, loads of those words were branded about. So I just kind of jumped on that bandwagon, really, of saying, yeah, we need a new world post-COVID. Here's something we could do, and we should harness the power of lifestyle medicine. And I think because there was that opening of, yes, we're terrified of post-COVID NHS and how we're going to tackle it. I think people who are, you know, are in charge of making decisions about new services, they were open to ideas. And, you know, I'm really lucky that Cwmtaf Morgannwg were willing to take a punt. And, you know, you obviously know how passionate I am, and I'm relentless, I would say, in saying, like, we really need to do this. And, you know, there will be enough people who want to make this work. There's enough people out there, enough patients who can support us to get this off the ground and to adapt it until it works. You know, that was my messaging, is we might not get it right. Let's keep adapting it by finding out what people need. What do we need as people?
And so how can we create an army of people, I don't want to say patients, but people who are demanding this? Because it, you know, this is centrally originated, isn't this? So this was driven by, you know, the executive in Cwmtaf and you in partnership saying, let's do something new. And you obviously had the knowledge of how, or the vision of how this could be. But how do we create an army of people in the community saying, we want this? Now, how are you going to make it happen? Mark?
Can I throw something in, which is to the mix, and I want to answer that question, but language. So one of the things that separates patients from their care sometimes is the language that medical professionals use, which are at odds to what is the patient's reality. So when I went home from medicine, I don't go to the going home service. I go to the discharge ward, right? Now, I don't know, but I live on North Devon in the coast, and I happen to be in the discharge ward with a retired water worker who told me, "Oh, bugger me, they're going to flush us out into the river like so much sewage," you know. And so it's not. And you mentioned the word army. I would like to reframe that and to say, how can we create a social movement? How can we create a group of people in the community that really wants to, who are up in arms? Well, I would suggest that what we do is we reframe this, that this is about communities, looking at how can we be healthy and well in our communities. How can we then reach out to the services and ask them to help us? How can we reach out to our local hospital and say, be in service to us, work with us, not the other way around, where we feel that we have to fit in to the hospital. And there's something about the importance of reframing, which I think we don't do enough of, and that's about different conversations, and it's about showing up differently. And the final thing I just want to say on this is, as a patient, I am passionate about the well-being of my healthcare team. I cannot believe how unwell my healthcare team is because of pressure and stress put upon them by a system that is talked about being caring. How can I be cared for by a system that cannot even care for its own staff? If we can't get the care of our own staff right, there's something not quite right. There's something rotten in the state of Denmark.
And I think you're absolutely right there, and that's why in Wales there is the quadruple aim, and the fourth aim is that we look after staff. Because sure, you know, if we look after the staff, then care and compassion happens. And we know from other examples across the country where there's been failures of that, and it's because of the culture and the drive just to push people through. Now, we've got some fabulous questions coming through, and I just want to pick this one up from just trying to read it, Curlin Buck, who's a physio, who says it's in picking up on the points you made, Mark, is, and this is also for Lisa as well, it's about the feeling of being ready for self-management. And is there a way to support patients to get to this stage? I think that's really beautifully put, because we talk about patient activation, and these are some of the questions that have come through, but this is about readiness. So Lisa, what do you think?
I think that's where we need to make sure that we're not using our own judgments in a consultation. You know, it's so easy just to say, oh, this person's clearly not ready, so I'm not even going to bother because it's too much pressure on my time. So I'm not even going to open up the discussion. But that's not our place, you know, and our place is not to judge if we think someone is ready or not. Our place is just to open up the conversation without judgment, and just plant the seeds and see, you know, just have a normal conversation like you would with a friend or a relative, you know, just bring it up. You know, it doesn't have to be this really scary thing that we're afraid of bringing up. Just bring it up because you would if a friend mentioned something to you, and see what comes back from it, and you'll soon know if they're open to it or not.
Yeah.
But they'll know to come back to you. You know, if someone else mentions and plants another seed, they'll know to come back to you to discuss it when they're ready.
Come and join us in North Devon, Lisa, for goodness sake. We need people like you down here.
We need to disconnect Mark immediately. He's clearly a gone rogue in trying to recruit people.
Yes.
Readiness. It's an art and a practice, and it's. I keep going on about it in this session, but self-management is relational. Yeah, it's relational with your relationship to yourself, and it's your relationship to others, and it's a journey, and it needs to be held, and it needs to be nurtured, and it needs to be kind and compassionate, both by the healthcare professional and the person, and it takes time. But all I will say is, if a healthcare professional shows up in relationship to me with a desire to truly want to be in service to me and my well-being, that will nurture my readiness. That will do more to support my readiness than anything. So it's the quality of the relationship.
I think we just need to be mindful of the fact of, like, why did we all come into these jobs in the first place? You know, this is not new innovative medicine or anything like that. This is just getting back to the roots of the old art of medicine, isn't it? Of actually just see what the patient comes in for, and, you know, offer your real world advice, not just whatever the latest medicine is, but just talk to them about what's actually important to them, and realize that, you know, it might be really routine for us and we've got a whole clinic full of patients, but for the other side, that's the most important thing that's happening in their day, and is highly stressful for the person on the other side. Even if it's just routine bloods, it's still a big thing for them. So we need to be mindful that we shouldn't be treating patients as just routine consultations, because that's where you miss the whole dynamic. I think for us, we're so time pressured, we do so much in a day, that it's really easy to just get through the numbers and just treat it as a routine consultation, when it's not routine, even if it's something minor for the person on the other side.
Isn't it amazing? Can I just really quick, isn't it amazing that we have to call what it sounds to be obvious from a holistic point of view? We've got no disrespect to you, Lisa, but we now got lifestyle medicine.
Yeah.
We have to call it something, for God's sake. We have to call what is so obvious about living well lifestyle medicine.
Yeah. But that's a reflection of the culture we're in, you see, Mark.
Exactly.
So that's the sad thing, really, is if I say it. So if I prescribe, you know, turning off your devices at 5 o'clock, then we're in a culture where that's more powerful than if your friend has said it. And we shouldn't have that culture. We absolutely shouldn't have that culture, but we do. So from my perspective, we just need to harness that power of, well, if the GP still has an influence, yes, let's use that, and let's bring that into the normal conversation.
So I know we're in the last few minutes now, and this conversation has been fantastic, and it could run and run. I'm aware that there's a lot of people on the call who are at the early stages of learning about patient self-management, and I'm interested to hear just from both of you, maybe where you where you got your learning, or where you go to learn more about what you're talking about and patient self-management?
Well, from my answers are going to be really short. So I'm a member of the British Society of Lifestyle Medicine, and they're in charge of getting all the latest evidence about lifestyle and behavioural changes that have shown effectiveness and what we should be recommending to patients. So they do lots of education on their platform, lots of conferences and courses, and a diploma, and that's for any type of healthcare professional. And also their annual conferences, patients can turn up to those and have free tickets to learn about it as well. So all the information is out there, isn't it? Like this, it's not difficult stuff, it's common sense stuff,
You would say that
rebranded, I suppose.
So we tried to set up in several of the services that I've led about patient engagement to help us redesign, about expert patients, however and peer support. And the only that I could find was for the services, as in the army over in the States, so for veterans, and they give some support, but we just don't seem to have an approach, a system. But maybe, Mark, you can say that there is.
You're not going to have peer support. You're not going to have those things at the center of our current NHS.
No, but to change that, how do we then, as individual services, encourage that change?
Well, we need more people like the three of you on here, with the way you think, the way you look at things, the way you approach things, your relationships with the people who show up, who want care. For me, around self-management, I've only suggested a way that works for me. We've got Lisa suggesting a slightly different approach to self-management, which is not at odds. It's complementary, but it's different. There will be people, I'm absolutely certain, who are listening to this call, who are probably screaming at the screens, look, this is what I do for self-management. This is what's important for me for self-management. And all of these things are relevant. And I think the more we can listen with open minds and open hearts to others and want to hear what they do in a spirit of collaboration and partnership, rather than this focus on experts who we give them part of our medical world is we rely on experts. They are important, but the danger with experts is they shut down the voices of other people who are not experts, who still have relevant lived experience. So I want to say, I learn from people who say, I self-manage myself, and I just want to go, tell me more, let me understand what you do. So it's being open-minded. It's a different attitude we need.
So I think we're about to have, we've only got a minute or two left, and I think that we're going to, obviously this is going to be a repeated theme through value-based healthcasts, because it is so fundamental to what we're doing, as exemplified by what Lisa's doing. But one of the things that we haven't brought up here is the systems approach. And I think Rachel Barlow, who sent in the question, was just wondering, I know somebody else, it was just about the political and the social aspects to this and the systems approach. And I think we need to maybe have a podcast around the systems, which doesn't just treat patients on a linear approach, and that patients are at different levels of what might be called activation, about self-management or self-leadership, that helps to support them. And that then might need a little bit more resource at the time, and then you back off, and then they've got a long period where they might then not need that support. So, and I would just, and mental health are grappling with this, about trying to think about how do we not just treat people on a linear approach. Wondered what you thought about that.
I think absolutely, but reach out to all those services, all those community groups that are, I can tell you now, there are out there hidden away, there are people who are really getting this in their communities and supporting. and the language they use is relevant to the people. They don't call social prescribing. They don't medicalize people going for walks in order to look after their health. They talk about, go for a walk to look after your health. I don't want to be activated, please.
Yes.
I just want to be motivated to get on with things. And I was motivated because I listened to somebody who cared for me, genuinely cared for me. And I know you didn't mean that, but language is so important. And I really understand that the medical system has its language and it's important. But I think if you really want to connect and help the management and the self-management of people, it's about the healthcare system reaching out into communities and starting to talk their language and understand how they see the world as patients trying to make sense of things. It's a cultural change that's required. And I love this podcast. I want to be part of this, so I'm going to be joining it from now on. It's brilliant.
Lisa, so I mean, Mark brought up lots of points there, and systems change and using the right language. Just to give you sort of the last word.
Yeah, that's exactly what we've noticed, and that's the reason why our coaches are non-clinical by background. So they wouldn't use any of those medicalized language because they're real people dealing with real people in their classes, and that is what's having an effect. Because the whole conversation is just natural, normal conversation between, from a compassionate coach who just really wants to support the person to get independent and empowered. And that's the way the coaches deal with it, the patients. And I think that's what's having an effect, is that feeling of being seen for just the person, not being treated just as a disease.
Oh, well, look, from
that is value-based healthcare. So just to be clear, that is value-based healthcare.
Well, look, Lisa and Mark, from Nick and I and the team behind us, including Sally, Brooke and Sam, thank you so much for joining us for the hour this afternoon. For me, I've been making notes as we've gone along. It's about the system, it's about using language, it's about listening. And this is the wrapper around all of that is people. Not medical people, but it's people, normal humans who are trying to navigate complexity and life. And again, thank you so much for joining us. Is it fair to say you're both happy for people to reach out to you and link up? Yeah,
absolutely.
So you joining us on the session. Mark and Lisa are happy to be contacted, as are Nick and I.
Yes.
But from the team, yeah, thank you to Lisa, to Mark, and for everybody joining the call. It's been great to see you.
Bye. Thank you, everyone.
Bye.